My name's Andrew. I'm one of the Council's environmental health officers, most commonly known as health inspectors. I've been working at Council for 12 or 13 years now, and I've known my way around the neighbourhood quite well. A lot of work that we do is in the background. You don't notice it until something's wrong. There is no real normal day as an environmental health officer. It could be anything from sitting around doing paperwork through to out doing inspections, food businesses, chasing down a case of food poisoning or other disease, neighbourhood complaints, checking out industrial sites for pollution. Favourite part of the job would be, I like an investigation with a challenge. Nothing where you just walk in and you've seen it before. When we go into a hoarder's house, one of the things we notice is there's often an odour. It's a musty sort of smell. It's an indication that there's poor circulation. There might be mould in the house as well as all the collections. Early in my career, I learned a few tricks of the trade. Put a dash of Vicks under your nose. It prevents the smells from just getting in there that you can't get rid of. As we go through the house, we have to try and see what's there. Are there pests running around? Is it clean and tidy? Are things stacked properly? In some cases, it's relatively harmless. People have their collections. And in some cases, though, it is a serious health issue. It is an issue for the individual at the house, but also for those living in the area. If there was a fire, could the MFS prevent that from spreading to neighbouring houses? Throughout my career, I've seen some interesting things. We'd come across a complaint where a rat had been found in a loaf of bread. It had obviously fallen in during the dough phase, been cooked in, gone through the bread slicer. By being there and finding a case like that, it meant that we could go through, work out if the actual business was safe, or whether it was a one-off incident, or whether it was an ongoing problem. The business had major issues that they had to fix. We're trying to prevent people getting sick to begin with, trying to prevent things going wrong. When the things do go wrong though, we also are out there trying to fix it up so that it doesn't go wrong again. When there is a start of an outbreak of some sort, like the flu that can spread, where they're trying to chase down the source to prevent it spreading further. We work with a lot of different organisations, both internally and externally. We work with the home care support team. We work with the engineers to try and improve access. We work with Red Cross, we work with SA Health and EPA. We work with Housing SA to try and help solve problems. A lot of times we're called out because there's a neighbourhood dispute. In the first instance, we're always there to try and educate and provide support and guidance. And in most cases, people appreciate that because they just didn't know what they needed to do. We're not here as a regulatory authority. We do when we have to, but we want to work with people to fix things, improve things. If you've got a concern about food safety or health and hygiene, give us a call. We'll see what we can do to help you out or provide you the answers.